In health news, getting to the heart of a cardiac problem going through genetic testing.
Well, there are only 2 sites in the state that are actually offering it. One of them is St. Francis Hospital and Medical Center. News 8's medical reporter Jocelyn Maminta is live tonight in the New Haven newsroom with more on what this is all about. Jocelyn?
And Darren, Yale is the other site in Connecticut with a cardiovascular genetics program. It's a collaborative effort between Yale, St. Francis, and a hospital in London. The unique and comprehensive approach was especially critical for the Ingoglia family.
Come on, Isabel, you're next.
Isabel Ingoglia was unaware she carried the gene for sudden, uncontrollable, and dangerous heart rhythms until genetic testing 5 years ago.
I have 2 natural children and a 50-50 chance of passing it on. I passed it on to both of them.
Son Anthony,
scary. It was very, very scary.
Was the first to find out he had the gene for long QT syndrome at 6 years old.
My son Anthony started passing out when he was 13 months old.
Daughter Ariel found out she too had the gene 6 months before she died in a car accident, which her family suspects was prompted by an episode.
Don't ignore these symptoms. Don't ignore palpitations. Don't ignore lightheadedness. Don't ignore blacking out.
And don't ignore your family history.
Their situation has been very unusual because they actually have had not only multiple family members affected, but multiple family members have manifested the disease and several have actually died from it.
Dr. Neil Lipman heads up the Inherited Cardiovascular Disease Program at St. Francis Hospital and Medical Center, where the family got tested.
When she first came to see me, she had had a near passing out spell. And had she just been someone without any kind of family history, we would have pursued one particular direction in her evaluation.
Instead, treatment includes having both mom,
The device is right under my skin,
and son
You doing all right there, Anthony?
getting an implantable defibrillator and closely monitored
No shocks or anything?
to help control the abnormal heart rhythms.
It has saved my life. And had I not had the genetic testing done, probably wouldn't be sitting here.
A lot scary, actually.
But it also helps.
Yes.
How so?
He knows what all my family members have.
Doctors know what to do for
Yep.
you.
If you have a genetic predisposition towards some form of heart disease, you will have that whether you know or not. And it's a lot easier for your doctors to make sure that you have the best possible outcome if they.
The genetic testing involves a blood test, but Dr. Lipman tells me it's not 100% reliable. It does not always find an abnormal gene. It does not always indicate there is a disease when there is an abnormality. And that's why there is a thorough evaluation of the patient's history as well as other members of the family. For more information, log on to WTNH.com.